Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the intraperitoneal organs, retroperitoneal organs, and the peritoneal cavity. The organs, those are suspended from the abdominal wall by the peritoneal folds, are called intraperitoneal organs. Peritoneal folds include the mesenteries and the ligaments. The intraperitoneal organs are almost completely covered by the visceral peritoneum and mostly parts of the gastrointestinal tract having mesentery. What are the intraperitoneal organs? Stomach, liver, spleen, duodenum, first part of the duodenum, initial part of the first part of the duodenum, and the part of the fourth part of the duodenum, jejunum, ileum, appendix, also called vermiform appendix, cecum, transverse colon, sigmoid colon, and the tail of the pancreas. These are the intraperitoneal organs. So, what are the retroperitoneal organs? The organs, those are not suspended in the abdominal cavity by the fold of peritoneum and lie between the parietal peritoneum and the abdominal wall, are called retroperitoneal organs. The retroperitoneal organs have no mesentery. Some of them had mesentery in the early intrauterine life, then it is lost. The organ is fixed to the posterior abdominal wall, so the mesentery has been lost, like eventually lost, like that of there is no mesentery for the ascending colon, no mesentery for the descending colon, because the colon has been fused to the posterior abdominal wall during the process of development. So, what are the retroperitoneal organs? Kidney, adrenal gland, also called suprarenal gland, aorta, inferior vena cava, duodenum, the second part, and the third part. Pancreas, except the tail, ureters, urinary bladder, ascending colon, descending colon, lower part of the esophagus, and the rectum. These are retroperitoneal organs. They are only small part is covered by peritoneum. Okay, but most of the part is buried between the parietal peritoneum and the abdominal wall. Okay, so we are looking at the small intestine here. Okay, so they are suspended by the mesentery, and we are seeing that the stomach has here attachment to the lesser omentum. We have the greater omentum here. Okay, so liver, the stomach, the small intestine, these are part of the these are in the group of intraperitoneal organs. Okay, so other structure other than that of this, the excuse me, the liver, stomach, small intestine. Also, we have the intraperitoneal structure is the appendix. Appendix has major appendix. Cecum is also has mesentery connection. Okay, so these are intraperitoneal structure. So other organs are like that of the duodenum, the second part and the third part. The pancreas, they are behind the parietal peritoneum, and they are between the parietal peritoneum and the abdominal wall. So this is retroperitoneal structure. Similarly, urinary bladder, It is only partly covered by peritoneum. This is an example of retroperitoneal structure, like rectum. Part of it is covered by the peritoneum, not the maximum part of the organ. So that is also a retroperitoneal organ. Okay, we got that. Now go to the next slide. You go there. What is peritoneal cavity? This is a potential space between the parietal peritoneum and visceral peritoneum. It is the cavity within the abdominal cavity extending to the pelvic cavity. It does not contain any organ. This is a potential cavity. So organs are present inside the abdominal cavity. Okay. So the peritoneal cavity, it also contains thin film of peritoneal fluid, not too much. If it is too much, then there will be ascites. That is not normal. Okay, so a thin film of peritoneal fluid derived from the mesothelium. Mesothelium is the simple squamous epithelium over the serous membrane like that of the pancreas, and the interstitial fluid, and is absorbed by the undersurface of the diaphragm. Undersurface of the diaphragm again covered by the parietal peritoneum. Peritoneal fluid lubricates the viscera so that the intestine can easily do the peristalsis, enabling the viscera to move freely over each other. Okay, so the peritoneal fluid has this function. The peritoneal fluid also contains lymphocyte and antibodies, even a few lymphocytes among the leukocytes. Okay, now we'll go to the peritoneal cavity. Okay, before we have done this part, the peritoneal fluid, we are still in the peritoneal cavity. Okay, there is some differences between the male peritoneal cavity and female peritoneal cavity. A male peritoneal cavity is a closed sac lined by mesothelium, simple squamous epithelium. The female peritoneal cavity has the following features. Okay, the peritoneal cavity is communicating to the exterior by the fallopian tube. Okay, so this is very important. It should communicate to the exterior by the fallopian tube. This is also an insufflation test is done to assess the patency of fallopian tube by passing air through the vagina. Okay, the obstetrician or gynecologist can assess the patency of the fallopian tube. This is very important for fertilization and conception. Okay, so the peritoneal cavity, female peritoneal cavity has the following features. What are these features? Peritoneal cavity is communicating to the exterior by the fallopian tube. So there should be insufflation test to diagnose the patency of the fallopian tube or uterine tube or sulpins. The epithelium over the ovary is simple cuboidal, not columnar. The epithelium over the fimbria are ciliated columnar. And that's all about our today's topic on the intraperitoneal organ, retroperitoneal organ, and the peritoneal cavity. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me. Have a nice day. Bye now.